giving Trevor some protection.
I don't know why Trevor's gone this year. Trevor needs to get traded during draft night so he can pick up a ton of picks.
We'll see.
Who cares? You got
This is
Mac Jones.
well, this is
Like sell him while he's high because Trevor Lawrence is not going to play well next year. I'm calling it right now.
I'm like I'm on 50-50 on him, after last season. But I give him this season. If he doesn't put on a performance, then I don't think he's a long-term solution. So, but we'll give it a few more minutes, and then we'll go ahead and do our weekly trivia.
Yeah. Give me
Looks like we
one
got
second.
Pete Chiropractic in here today. Love to see it. Epic Compliance customer. Meta, nice to have you on the webinar as well. If you guys could if you guys could be so kind, put in chat or just say hi or put an emoji. I just want to make sure chat's working before we get started. Don't be
Let me see if
shy.
I can appease the demon real quick. I'll be right back.
Sure, sure. Trying to figure out who's on here from Peak Chiropractic. Put it in chat.
I'm in
Who
the
is it?
chat. Yeah. Self-report.
That's fine. They can if I don't see anything, I'm reaching out later. I got to figure out who it is. But we'll go ahead and get started. I'm going to share screen. Jose, let me know if you can see. Feel free to participate on this one as well. Oops, I did not mean to do that. Let me know if you can see, Jose.
Yep.
So, for those of you that are just joining in new, last week we talked a little bit about the CARES Act. So today's trivia is going to be in reference to that. If you're just joining here new, don't worry. Feel free to take a educated guess. But the question for today's trivia is: which section of the CARES Act expanded access to telehealth services for patients with substance abuse use disorders? And the choices: A, Section 3022, Section 3703, C, Section 3211, and D, Section 2306. Go ahead and put your answers in the chat. Again, don't be shy. Give it another 10 seconds. Jose, do you know the answer?
I want to say it's A, but I'm not. I don't know why 3022 sounds right to me, but I don't think it is. It sounds right to me.
So again, the question is, which section of the CARES Act expanded access to telehealth services for patients with substance use disorders? And the answer is actually B, Section 3703. And Section 3703 of the CARES Act temporarily waived restrictions on telehealth services, allowing Medicare beneficiaries to access substance use disorder treatment remotely. That including medication-assisted treatment and counseling. So, Jose, appreciate your participation.
I was way wrong, but
It's
let's punch it.
okay. we sort of briefly talked about it last week. I just wanted to see if maybe we had somebody on last week that could take a legitimate stab at it, but it's all good. So
Yeah,
we'll go ahead and dive into today's subject. Again, I'm going to just switch over to the presentation. Jose, just confirm that you can see it for me.
let's see it. So, yep, it's up.
Awesome. So, good morning, good afternoon, everyone, and welcome to today's episode of our compliance step-by-step webinars. And today's topic, we are going to be talking about healthcare billing compliance, particularly with maximizing MIPS with safer guide navigation. Again, for those of you that have joined in new, have done a couple webinars. I think Jose, back in February on sort of the premise of MIPS. It might have been early
So,
March.
yeah, we did in December, and
Yep,
then I think we mentioned it slightly in February, March, but that was before some more information came out.
right,
So,
right. So today's subject, as mentioned, we're going to be talking about the safer guides and particularly leveraging the power of safer guides developed by the Office of National Coordinator for the Health IT and how that maximizing MIPS in that aspect. And just to give you guys a little bit of background on EPI compliance, we've been around since 2013. And to simply put it, we specialize in healthcare compliance, specifically with OSHA, HIPAA privacy, HIPAA security, and Medicare waste, fraud, and abuse regulations. And our goal is simple. We want to provide compliance solutions to healthcare providers, healthcare practices, business associates, as well as healthcare students by providing tailored solutions that fit your needs. Additionally, we have created a in-person event, and we started this back in 2016. It might have been a little earlier. Don't quote me on that.
it
Um,
all rolls together now, you know.
yep, I know it. But we started an event, in-person event called Epi Conferences, and it's sort of based around healthcare innovation and compliance. And in particular, at these in-person events, we host a training certification. We call it a Certified HIPAA Security Officer Training, which is a sort of dedicated training for healthcare administrators, healthcare business owners, compliance officers, to really give you a deeper perspective into HIPAA and HIPAA compliance and what it entails. And this is a training, as I mentioned, that we're offering in person, soon to be offering online. Please stay tuned. We're very excited to release this course. Our target is going to be end of this month. So stay tuned. We will be sending some correspondence out for that. But again, we are very excited to be offering that online very soon. And um, again, I'm joined today by my co-host, Jose Delgado. Jose, appreciate you being on here again. And just to give you a little bit of background of Jose. He's been in currently owns a telehealth uh, a mental telehealth clinic, and also has over close to 2 decades worth of experience in healthcare consulting. So, Jose, I'm glad to have you on. Anything you want to add to the audience before we get started?
The consulting business, it's family owned. It's been around since 95, so 1995. Just so, and I'm sure we have some people here that don't even know what we're born in the 1900s now, but now we complete cradle to grave when it comes to healthcare business. We've done everything from startups to transitions to sales to expansions, contractions, mergers, compliance, you name it, we've done it. So we've worked with companies nationwide, even done some things internationally here in the Caribbean and everything. So yeah, it's always interesting to see where people want to go with healthcare and where the different legislations push us to go. So
No,
it's kind of
absolutely. Appreciate
hey,
that, Jose. And we'll sort of dive into the presentation again. For those of you that just joined in, we've done some presentations in the past on MIPS. I put the slide up just to sort of cover the basics. But again, for those of you that are unaware of what MIPS is at this point, MIPS is a value-based care program introduced by the Centers for Medicare and Medicaid Services. Its primary objective is to elevate the quality of care foster seamless care coordination and prioritize cost effectiveness in the healthcare delivery. And ultimately, the goal is to benefit both the provider and the patients. But really, today's topic, we want to dive into, would you say this is newer legislation, Jose? Safer guides?
Yeah, this is a lot more this is a lot more recent, and now
Yes.
it's actually starting to get teeth. So last year you didn't really have to do anything. We're getting a lot of phone calls about, oh my God, what do we do? The too long don't read of this. If you're not worried about macro and MIPS, the safer guides do not matter to you. Just real nice and simple. Now,
Right.
if you're concerned about macro and MIPS, safer guides applies to you. Now, how it applies when you look at it, which if you want, Ray, you can jump to the next slide because I
Sure.
know that we
Yeah.
kind of broke it. Yeah. So all of this is so much fun, right? So it looks relatively easy, but as with anything federal government related, when you click on number one, it's actually 10 line items and then there are 10 line items within each line item. So it's very much it gets complex quickly. Luckily, for most practices in the United States, you're not going to have to be concerned with every single module. There's only two main modules that you care about. It's the can't remember the names
So,
of fifth
uh,
and sixth.
so there's three. Maybe this is what you're referring to, Jose. And I just sent a link over in chat. This is sort of this is the healthit.gov site, and it sort of explains each of these 9 safer guides, but it puts it into sections, which is the foundational guides, the infrastructure guides, and the clinical process guides.
Yeah, so I mean, we're just going to be going over some of them with our first clients like this year, probably in the next month or so.
Mhm.
And the reason is because this is relatively new in the respect of that it matters. So if you are intending to try to get points for macro and MIPS, you have to do the safer guides this year.
Right.
Now, when I say you have to do the safer guides, I mean you have to answer the questions. So go through module five, go through module six. Um, hey, I'm doing it. Hey, I'm not doing it, but you got to go through it.
And those questions you're referring to, Jose, are you talking about the checklist that is provided on the Health IT site?
Yes, and you got to submit it online.
So again, for those of you that are unaware of that checklist, the link that I sent over in chat, you'll find that each, and actually I'm just going to drag this over real fast so that the audience can see. But you click any of these links here, right? These are the 9 safer guides. We'll just say you want to start your high priority practices checklist. If you scroll down, you'll sort of see the checklist available to you. These are all fillable fields, so
Yeah,
it's all there for you.
yeah. The good news is that you get to fill it online. The bad
Yes.
news is you fill it online, and the reason
Yeah.
is bad is that again, when you click yes to a question, it's going to drop down another drop box. So
Right.
it can infinitely expand, honestly, based on the way programming works. It can infinitely expand, but realistically, I believe that each section map pops out, each question tops out of like 10 sub questions, but that
Right.
adds up quickly. So if you're intending to do, and just like the way macro and MIPS and meaningful use used to work, it's 90 days. It's over a 90-day period that you're doing all this.
Mhm.
If you're a hospital, if you're an insurance carrier, God bless your soul. You're going to be working on this for the rest of the year. If you're a smaller practice, again, there's two sections that actually matter. The rest do not. If you are intending to go for macro and MIPS bonuses, you've got to go through those two modules. If you don't intend to go for macro MIPS, don't bother. If you go through the safer guides, but you don't do your HIPAA security risk analysis, but don't worry about it. You're not getting any points. So it's one of those things where doing the safer guide, if you don't do the safer guides and you
Mhm.
try to go for the macro MIPS numbers, you're automatically gonna get hit with like a 25% deduction for that section in regards to practice. I want to say it's the clinical efficiencies or something like that, where it's worth 25%. You'll get a flat
Wow.
zero. So you have to be perfect in everything else just to get like a 1 or 2%. So it's one of those things where you have to do the safer guides if you're going to go for macro MIPS. And remember that this is anything with the federal government is going to require you to attest to it. Ever since
Sure.
Obamacare passed, if you're the one attesting to it, assume that there is a alphabet agency that will crucify you for screwing up. Now,
Right.
when I say screwing up, I mean attesting for things that you did not do, not for getting things wrong. So the safer guides is not asking, hey, it's got to be perfect right. Right now, it's saying, hey, are you doing this? Are you not doing this? Are you intending to do this? So just you can go through it on your own, but it's going to be easier for a lot of people, especially if billing is not their 100% job and macro and MIPS has not been their 100% job for the last 3 years, to have somebody helping them. So, somebody that has a strong billing background or strong compliance background will definitely be able to help you out with that.
I was going to say
So,
there's definitely different parts to this I've noticed, and in other words, you might be, and it depends on the size of your practice and the scope, but obviously compliance officer probably the best person to complete this. But I've noticed there's some IT related stuff in here as well. Might be better to have IT. Uh,
well, it depends on the size of your practice.
right.
Modules you have to do. If you're a larger practice, you're going to have to do it all. If you're a hospital, you have to do it all. If you're an FKHC, you got to do it all. So, if you're a nursing home, I think you can sneak by with only doing the 5 or 6. I have to double check. I honestly don't know. But you're really looking at the whole, um, what are we trying to do? And again, with the whole change healthcare cyber attack, this is probably going to change. And the level of scrutiny that certain organizations are going to get for this is probably going to change. Some of these institutions aren't going to be able to just skate by saying, yeah, 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 we're doing it. So it should be very, very interesting how this target progresses throughout the year. So let's some of this stuff is relatively easy to take a look at, right? So
Sure.
and deal with. So when we're looking at patient safety and care quality, any quality category is going to be subjective rather than objective, unless there's something there that they're specifically saying, like one of the popular ones in meaningful use was what's the percentage of your patients that you're e-prescribing? As with everything, do not assume the EHRs are going to help you.
Yeah.
So when you're attesting to something, make sure that you have all the support data there. And keep in mind, you're going to have to keep this for a couple of years. The federal government is always 4 to 7 years behind the game when it comes to chasing people down for things. I mean, we
Sure.
have clients that are getting audited for data from pre-COVID still, which is wild. Because
That
I
is.
mean,
So they're getting
we're
audited retroactively,
you're
essentially.
always audited retroactively. So the
Yeah.
federal government has never been caught up to live audits, right? Unless
Right.
something pops up and they put you in prepayment review, right? So what ends up happening usually is that they send out the contract um to different vendors. We've actually been a vendor and we've actually done a couple of these audits, not
Mhm.
these ones, but similar audits for practices and for the federal government. And basically what you do is they send out an RFP and they say, all right, we're looking for someone to audit this many things over the period of calendar year 2019, but you're doing it now in 2024. That's why they say you got to hold on to this stuff for
No,
half a decade.
absolutely. No, I know that. I knew that much. You want to hang on to your documentation. What, up to 5 years? I think, as far as they can go back, or
I would honestly say you want to hold it up to the statute of limitations.
which is what, 10 year
Depending. So if you
for
got in
good
trouble,
measure.
yeah, if you got in trouble for something like this, they're basically going to hit you with fraud. So 7 years.
Yeah. Okay. Gotcha.
You know what I mean? Like, and of course, it doesn't include if you get caught with obstruction or just deleting evidence, which apparently it only matters for some people, some classes of people. So uh, basically, what we're looking at is with something like this, I would say you need to hold on to it for 7 years. So make
Understood.
sure you got what you're
Good to know.
attesting to, and if you're the administrator, you need to figure out who's attesting to this stuff and where they have that data, because it's not uncommon that I'll get called into a practice, they're getting audited, and they've gone through since that calendar year 2 office managers and 3 different billing companies. So then we're sitting here like we can't
So,
even to the people that did the work and attested to it because they're not even here.
right. And that office manager is probably running around with their head cut off because they don't know what's going on either.
Assuming that
Right.
it's the same one. You know what I mean?
Yeah.
Like
Yeah.
in a larger practice, in a medium-sized practice, turnover even at the management level is not uncommon. It's only the smaller 1 doc, 2 doc shops where you have that office manager that's there their entire career. The 25, 20, 30
Right.
years where they know the business better than the owner. Those are becoming increasingly rare. So which honestly, it's sad because those are the best office managers that exist in the industry. Hands down,
Oh
fight me
yeah.
out.
They're the certified firefighter and veteran of the. I mean,
There's the multitasking
yeah.
already
Yeah.
because they've been doing it for so long. They've already seen this cyclical nature of the federal government because a lot of the people retiring right now that have been in that kind of field, they actually remember doing business or they were around doing business when there was not major medical insurance.
Right.
Remember, before 1990, there was no such thing as major medical. You had catastrophic or you had no insurance or you had Medicare. That was it.
Yeah.
And now everybody's going back to that model because the insurances are paying like crap. That's a whole nother bag of tricks we're not going to get into today.
We'll
But
be
yeah,
getting into that eventually. It's a
but
good
okay,
topic.
cool. So let's get back to the safer guides though.
Yep.
So
Yep.
so
So
you want to go, and if you're going to go for macro MIPS, you've got to do the safer guides. If you're a smaller practice, you do the 2 modules. You don't have to this year they're looking for information, they're not looking for complete compliance. So hey, we're doing this, hey, we're not doing this, hey, we're doing some of this. But you got to go through the process. That will probably change next year.
I was gonna
Realistically, it change next year.
I was gonna say, Jose, we sort of talked about it earlier with the checklist and whatnot for the safer guy, but how do healthcare organizations measure the impact of implementing the safer guide practices on their MIPS performance scores? Like how does that work? Can you elaborate on that?
It's kind of wonky. The math is weird. How they do all of that is kind of odd.
Yeah.
To me personally, because it's not really intuitive. Especially not intuitive for the importance for the practice. But supposedly the safer guides clocks in right in that section, that 25% section that we were just talking about, which
Right.
I believe is the God, what's the name of that section? I want to say it's the clinical optimization section.
Is it the would it be the promoting interoperability section or
Think
no?
that's
Improvement
I think
activities?
Yeah, I think it's that one.
Okay.
Um, but it's so basically not only do you have to do everything for macro MIPS, which the EHRs help you, but then you got to do this if you're going to go for that. And then one major component of that, which the safer guides mentioned specifically, is the HIPAA security risk analysis. And I do remember that because that one hit me pretty hard because I was like, wait a minute. So they're telling you this shit is so important that they're making you attest to it twice.
Right.
So um that's great for me as a consultant.
Yeah, I
To
was gonna say
me,
it's
yeah,
a
I mean,
requirement. You got to do it.
but now they're putting more teeth on it, right? So
Right.
now, mean, and with all the cyber attacks coming through, I promise you that they're going to be only more difficult about it and more stringent about that requirement, because there's a lot of things that when done correctly or even done incorrectly, you can find a lot of holes in practices. And you can find a lot of holes in the institution of the practice, and a lot of the protocols and procedures and lack of knowledge, and which again, lack of knowledge can come from the fact that there's high turnover at the lower levels of healthcare. But in the smaller practices, it's also kind of a worst kept secret that training is not really a thing. You kind of learn
Right.
on the job as you go in a smaller practice, because again, the person who would teach you is the person who's been there the longest, which is the office manager normally, and that person's doing 40 hours a week of fire manning, along with dealing with the provider personalities, along with sometimes being the personal assistant of the providers, and then running the business and dealing with all the vendors.
I call
It
that
gets
job security, but yeah.
eh, it's I mean the joke that I normally have is, if an office manager is there more than 5 years, you've become the spouse of the practice.
Yeah. No, that's a
I
good
mean,
point. That's a good point.
without you, the
It
practice is lost. And I
it is
can't say
sad though. I mean, you said it earlier. I mean, there's such high turnover. It just if you make it that far, which I mean, 5 years
which
is I mean, it's a
which
long time, but
5 years doesn't sound like a lot, and then you're just like, that's a presidential administration. Maybe
yeah,
that is, you
exactly.
know. So you kind of, it's a double-edged coin, right? Like,
Right.
depending on the environment as well, which the providers and the owners are just as much dictators of that culture in the office as the office manager is. So we've got to make sure that, in order to increase compliance, we've got to increase cohesion and
Yes.
retention. So it all kind of rolls back into, I'm not much of a hippie about it, but if your employees are happy, they're at least not actively trying to screw you,
Yeah.
and
No. Good point.
that's sometimes all you can hope for, So yeah, so let's go on to the next piece.
So this was one of the guidelines to the safer to organizational responsibilities. I think we try to elaborate on a few of
That's the
these just
section,
yeah,
the
because these
quality
aren't
of promoting
right,
interoperability.
right. So think we elaborate on this just a little more.
Yeah, so this is going to some of the quality stuff, right? So when it comes to test result follow-up, are you ordering stuff and then not looking at it and then not talking to the patient about it afterwards? Like, hey, all right, I want you to go get an X-ray, or I want you to go get an MRI on this, or I want you to go get a colonoscopy, whatever. Are we looking at the results and communicating with the patients? I mean, I can't tell you how many times in the mental health field where we get a referral from our PCPs, and the PCPs are like, "Hey, just I want to know what's going on." Okay, cool. So we do an eval on the patient, then we send it back and we recommend what we recommend, and that's that. But I can't tell you how many times the patient calls us at the practice to ask us what's going on with that, when the providers had a report for weeks.
That's fair.
Like, I'm sorry, but if you ask me to go get some kind of blood work done, and I got that done 3 weeks ago, why haven't I even gotten a message about it? You
Right.
know?
It shouldn't be that long of a turnaround.
No, it's really not that complex.
Right.
So it's just a matter of communication, right? And there may be some things where the provider himself is too busy, but then you need to spend the time and the resources on having somebody follow up with those patients, so maybe it's an RN, maybe it's an
Oh,
MA, maybe it's someone that is good on the phone, maybe whatever
maybe
whatever you're doing there.
setting up reminders through a system as well,
Well, not even just a reminder,
automated.
but it's a hey, heads up, Mickey Mouse, you're
Right.
one of my patients, perfect. Hey,
Right.
we asked you to go check out your GI because the meds were messing with your stomach, and we're over here in mental health trying to figure out what's going on. Okay, cool. Well, what happened with that endoscopy?
Right.
All right. So once we got the endoscopy report, we got to get with the patient, right? I mean, right now, most people are still on a fee for service kind of setup. Set that appointment up.
Right.
Like
That's
hell, if it's an RN following up with the patient, you can bill a 212 on that. Just document it. So
right.
it's not that big a deal. There's ways to do it where it'll mitigate the costs associated. When it comes to medication management, are the patients aware of the risks and reward of jumping onto a certain medication or a certain cocktail? Again, I always mention mental health because I'm dealing with that one every day. Are they aware of what these meds are going or what these side effects are? Hey, all right, cool. I may get you on antidepressant or anti-anxiety, but you're going to gain a little bit of weight. Heads up.
Yeah.
Or that
Heads
may be
up.
very
Let's make that
sensitive for
make
a
that known.
female. Yeah, that may be very sensitive this time of year for females of a certain age that are getting ready for, beach season.
Summer. Yep.
Like it may be something to where, hey, we have an ex addict and these medications can be habit forming. Is this appropriate for that patient, or do we need to find another methodology for this? Or you know what I mean? So there's a lot of different things that you can
Sure.
do two and two, and it's just coordination. Aligning with the MIPS qualities and promoting interoperability. I mean, that's what we're doing right now. Like if I'm working with the primary care, I got to be talking to them.
Yeah.
If my
Yeah.
patient's a Medicare patient, which this is what it matters to, right? Um, if you go to a paper clinic, I've seen some of these Medicare patients that have records, and their records are binders, no bullshit, 2 inches thick, and it's one of four.
Oh wow.
I mean, and that's just for that one specialist that has only a copy of certain things from the other specialties that they're on. If they're a Medicare patient and they're seeing me in my mental health practice, they probably have cardiologist. They
Right.
may have a rheumatologist. They may be seeing me because they're just getting off of cancer or they just got diagnosed with cancer. They may be seeing me because, they're in pain management.
Right.
And then their primary care. And then their GI. I mean, the amounts of meds that some of my providers have to go through, like they joke if it's a Medicare patient, sometimes they need 45 minutes just to go through the medication checklist before they see the patient. They're just like, is this everything? Because there's 10 meds on here. How am I this is a nightmare. Do I want to put my fingers in this cookie jar? And then
It's
what kind of I mean, when you have so many meds on there, you
a hot potato.
know that yeah, well, yeah, exactly. You know that something is gonna be, and we've seen it before in malpractice cases, right? If you've been in the game long enough, you've seen it to where, oh, it's a wrongful death, the patient died. Well, they're on 15 meds, and then they start trying to pin it based on who was the last one to prescribe. Oh, well, they just saw the pain management last. He didn't adjust it based on the med management from the mental health, or and
Right.
it just becomes a nightmare. So, I mean, you can't discriminate technically, but I mean, you can definitely go and say, hey, we're not taking these kinds of patients with these kinds of diagnoses, so it can reduce the
You
the
do have that
liability.
choice.
Huh?
I said that at least you have that choice, if you
Well, I mean, yeah,
if you get
but there's
into
a
that.
way to do it properly,
Oh, of
right? Like,
course. You want to
so
be
because I mean,
professional.
they pay you whether they're complex or simple, the same.
Sure.
So you've really got to start taking a look at all the pieces of this. When we look at organizational responsibilities, yeah, again, we were talking about company culture, right? And commitment and accountability. Like, um, if I am running my office poorly, you're going to tell immediately from the morale of the staff.
Absolutely. And
We can have a shit day at the practice, but everybody's leaving like, okay, I did something. And they're coming back the next day with a smile on their face.
right.
You
Right.
can tell when the morale is bad because the employee walking in already has a scowl.
you can also tell that the morale is bad if you're getting a ton of turnover as well.
Well,
As
and
a
well, the turnover one is a little bit trickier, right? Because depending on where I am, I may just be getting priced out of the market as well if I'm a small practice. So
fair,
if I'm in Jacksonville, if I'm in Orlando, okay, well, practices that have a bigger budget can support even just offering benefits that a smaller practice can't. The irony being that most times these practices are getting offered insurances that they themselves will not take, but we're not going to touch that piece of that piece of hilarity.
so
But
you're
I mean,
referring to like mid-size, larger organizations that are sort of, I want to say
well,
poaching, but it's just,
well,
the let's just say it's a specialty, right? Cardiologist, or you get a mid-size or a large cardiologist practice, and you're working at a smaller practice. Yeah, I can see what
it's it's not even the specialty difference. It's, for example,
right,
it's just a company of scale. If I
yeah,
have 15 employees, including the owners, the health insurance per person, no matter if everybody's under the age of 30 and they're all super healthy and all this crap, is not going to be sustainable on that kind of a budget. If I got 15 people versus if I've got 200,
right,
I've got 7 locations, I've got 15 providers. Like that kind of budget you can support even if it's the same pay. The fact that they're able to offer health insurance creates a level of
creates
retention,
the
which
yeah,
is
yeah,
something that if you're a smaller office, how do you compete with that? Well, you got to compete with that with the culture. You got to compete with that with the level of um people want to be heard, they want to be valued. And there are places, and I've had employees do this too, and providers and line employees, where they've left for the money and they've wanted to come back, and it's not going to happen because you've already left for the money. I've already filled your spot.
yep,
It's not waiting for you.
yep,
You made a decision, which is your decision. You're perfectly allowed to do that, and it's your responsibility if you're the head of the household to do best for your family. But I've got to do best for who's here, and if you're going to cut and run, then I've got to stick to my line. Because if I start showing, hey, this person can cut and run and then they can come
and then
back
they
when they're
come
not
back
happy
and
because they didn't get along or whatever the case may be, then all of a sudden you're gonna get higher turnover just because the employees know that they can walk out, try another thing. They can monkey branch, if you will,
yeah,
and before they let you go, they're like, "No, this is a solid branch. All right, cool. Now I'm gonna let go. Oh wait, it's not that solid over here. I'm gonna let go. It may be more money, but they're maybe making me do more. Maybe I don't get along with the management. Maybe I don't get along with the culture of the people there. So it just kind of depends, right? And that stuff.
sure,
And you can, and in that kind of culture as well, though, you can also put in that, hey, compliance is important because we don't want you getting in trouble, but you don't want the practice getting into trouble. Because if the practice gets into trouble, somebody's got to get fired. If for
yep,
nothing else, then the fine is going to take up your budget. Like, let's just be
which is going to
perfectly
reduce the morale.
Yeah, exactly. Let's just be perfectly upfront and honest about it, right?
Yeah,
If
no,
we get a fine and one of these fines is $50,000, which is not unheard of, and that's per incident, but let's just go ahead and said they found the unicorn. We negotiated down to 50K. Well, ladies and gentlemen, guess what? That's at least one person.
yeah, that's one
And I
person's
just
salary.
I gotta let you go. It's not even that you may have, and it may not have even been the person that did the mistake is getting let go. And it may not be, it may be something that, hey, we got hacked, but it's still on us because of something. Well, we still got to pay that
We have
fine.
a
That fine's
business
got to come out
associate
of,
agreement in place. Boom.
yeah, I mean, that stuff, it just comes out of somewhere.
Yeah,
So I mean, you got to figure that stuff out. I mean, and in some cases, maybe when we start going through the safer guides, we'll be able to go and when we really start jumping in and seeing how they pay out, is the juice worth the squeeze?
no,
Would I rather say no to 5 extra% of Medicare and not have to do all this paperwork? Maybe that's a yes.
it could be. I'd say it depends.
I mean, it always depends. But it's,
Sure.
do I have the resources? Do I have the time? Is Medicare a major part of my practice, and do I want it to continue to be? Or do I want to pivot or start pivoting?
Yeah, good point.
I mean, as much as the federal government wants to keep putting more and more and more legislation here, you're going to see people fighting back on it in a lot of different small ways. Like you're already seeing quite a few providers that are going back to paper records and just saying, screw it, I'll submit it electronically, but I'm not going to do this EHR nonsense anymore. I'm going to go back to paper, leave me alone. I don't have to worry about HIPAA security. I don't have to worry about this. I don't have to worry about this. I don't have to worry about this. I'll take the pay cut.
I, I'll tell you,
It's
I've noticed more. I've noticed more and more. There's some practices that are straight up just that's what they're doing. They're cash based. They're doing everything on paper, and they're keeping their
I mean,
limiting their liability
I
is
mean,
what
it's
that
not
is.
even just limiting their liability, but limiting their headaches.
Right, right.
If
As
I've
a
got a
whole,
ship, yeah, if I've got a ship that I don't think is going to be a blue water ship, but it can get into, some offshore shenanigans. I want to put as few holes in this boat as possible. When I'm
yeah.
dealing with a bunch of compliance stuff, I'm dealing more and more compliance stuff, more and more HR stuff because OSHA doesn't stop. I'm dealing with more and more competitors. I'm dealing with all the insurances. I got to start plugging these holes. I got to start, and I only have so many fingers and toes.
I was gonna say that I noticed it mainly for the smaller end practices. I don't. I mean, if you're a mid-size level, I don't think it's
You're screwed.
you can't
You're
go
screwed.
back.
Yeah, you
you're
get to a size where
you're locked in,
yeah, you gotta
and
do it. You know what I mean?
you need
Like,
to navigate this,
yeah.
or figure out if it's worth it or not.
Well, and again, it's one of those things where depending on the size of the ship is how easy it is to move. And
Right,
because of that, you may be screwed in on doing this. And this may be a multi-year exit strategy.
right,
So if you're let's just say that 50 employee, 7 location, 15 provider office, you may have to steer into the wave on this one and bite the bullet and go through it and then really assess though how much it costs you to get this money.
right, right,
Because if you ask providers to this day, I I would actually say 85 to 90% will tell you that the meaningful use incentives were bullshit. And they were not enough to cover the cost of complying with meaningful use. And honestly, I believe macro is the same thing, but I mean, every practice is a little bit different.
right.
So, I mean, I'm curious to see how it all goes. Everything's moving. Um, everything's going to continue shifting as the results of the larger cyber attacks come into play. And you'll start seeing that the safer guide is going to shift and adjust for next year because everything does once big iceberg items like this one hit. Um, so it'll be very, very interesting to see how it goes. If you have any questions, if you have any concerns, definitely reach out to Ray and myself. Talk to your billing company and talk to your billing people. If your billing people are concerned, we're more than happy to sit down with them and be like, all right, well, what's the situation specifically for your practice? Because a dermatology practice is going to be different than a cardiology, than primary care. The layout and the cost is going to be different as well. Is this something that your billing company is willing to take on the chin and help you guide through it because they want the reimbursement? Because a lot of these billing companies get
Makes
paid on what
sense.
they recover.
Yeah, yeah,
So some of these
makes
billing
sense.
companies may be like, all right, cool. Well, we were helping you with macro, but screw this. This may be too much. You know what I mean? Like, so there's a
It's a
lot of
testament to
pieces
see,
here.
see what
Huh?
they. I said it's a testament. You test your billing company, see how far they're willing to go.
I mean, if you're asking me for 8 to 10%
Yeah,
of what
yeah,
you recover, and let's be honest, in healthcare, 70% of the money comes in from you just data entry and pushing a button.
Yep.
You're fighting for the other 30%, which is the part that most billing companies do not want to do, which is really the whole purpose of their
Of a
existence, but
billing
it's
company.
another bag of tricks.
Gosh.
That's a whole nother bag of tricks.
Oh man.
But yeah, I mean, it's if you're getting 7 or 8%, I would rather my clients all get the maximum macro percentage they can get
Sure.
because that trickles down to me.
Yeah. No, yeah.
So I mean, oh, you got 100K, perfect. I'm getting 7, 8% of that. I'm got cool. I got 7K from you last year. Oh, wait. We got to do some paperwork so we can get you to 112. Oh no. Or we can get to 108,
Is it
110.
worth? Is it?
Hold on
Is the
now.
juice worth the squeeze
Is the
there? Come
juice
on.
worth the squeeze? It always comes back to that,
Yeah.
And then
Yeah.
a lot of at some point as well, trying to keep up with the compliance is going to hurt the actual care with the patients, which sucks because the whole intended purpose of this is to increase the care of the patient. So, I
Does
mean,
it really? No. Well,
it's how can I put this? I can see the intended goal. The problem is lawyers write this stuff and they have no idea what it's like to be in a
they're not
practice.
physicians, and yeah.
But it's not even about being a physician, because I'll be honest with you too. Most physicians don't know their ass from their elbow when it comes to running a business. They just know how to see
You're not
patients.
not wrong. Yeah, that's what they go to school for.
You know what I mean? Like when I go
They
to a
don't they
practice,
don't
my
learn
biggest,
these
I
things
mean,
in med school.
yeah, I mean, when I go to a practice and I'm doing something for compliance, it's okay. Your biggest liability is always going to be your personnel. And when I break
Yep.
down who's your biggest liability in your personnel, 9 times out of 10, it's the providers.
Mm, yep.
And for the same reason, they're just like, look, this compliance stuff is just in my way from me doing my job. And that's the seesaw we have to always.
It's always seen as a burden.
Yeah, absolutely.
But
And a lot of them will be like, this is an unnecessary burden because if I do my job right, I'm following this. But now you're asking me to do paperwork to show that I'm following this, to show that
that's
I'm
what they
doing,
want to see. That's what the federal
yeah.
government wants to see. They want to see
Yep.
the documentation. They want to see that you're doing it right.
Work with government.
Yeah.
Work with government. I mean, ask a family member, because now between state, local, and federal government's so big, you probably have somebody in your family that works for the government.
That's a
So
true
ask
story.
them, how much paperwork do you have?
Yeah.
How much paperwork do you have on a daily basis? Like it's that old Office Space joke. Where are those reports?
Yeah.
Those TPS reports.
I would say above all, if you're one of those organizations that don't have anything in place, or maybe you're you're doing some of the things maybe in-house, then I recommend, and Jose mentioned earlier, please reach out to us. We have programs that are tailored to your needs. If you're looking for a one-all be-all solution, we do have a solution for that, being our pro package, where again we provide all the compliance measures, the training, the policies, the business associate agreements, tasking, so that you keep up with this documentation ongoing throughout the year.
At
So
this point, honestly, if I see a practice that is doing their compliance in-house, I don't even bother talking
yeah.
about compliance. We have come past the days where you can get away with doing that ish on your own. It's just too much and it's too complex. If you are actually able to do it on your own, the business is suffering.
Yeah, something's suffering because you just
There's no
you
way. It's
can't do it
just
on
too
your own,
much.
especially
There's
with
too
all the
much.
regulation changes. I mean, that alone right there is just, I mean, that's a full-time job.
Yeah, oh yeah. I mean,
I mean,
the one that is really kicking people in the teeth right now here in Florida that I've seen lately is they got disaster preparedness,
yep.
but disaster preparedness now also includes active shooter
Oh, wow, they're starting to introduce that.
because it's a disaster. It's a
Sure,
contingency plan.
sure, sure. That makes
So
sense.
it's just like you just can't do it all on your own.
I was
I
saying
mean,
in like California, Oregon, those states on the
some
West
of the
Coast,
wilder states.
they're they're uh they're making active shooter like like a required training over there. So that's,
Oh yeah.
that's something that
Oh
we've
yeah.
had to, us as a company had to sort of pivot on and be able to offer that solution.
And
It's
it's gonna be, and I guarantee you it'll shift from active shooter to just angry person that's coming
yeah,
in with just a knife or with a, with a bat, not
yeah,
just someone with,
any situation, yeah,
yeah. So I mean, yeah, yeah, they're gonna come in with a slingshot.
enraged.
I mean, like, so we just gotta go and we just gotta prepare for
Yeah,
that stuff
yeah, no,
and make sure that our people are aware and make it as simple as possible.
yeah,
Like the
absolutely.
same contingency plan for the active shooter, maybe it's the same contingency plan for a tornado or for
Yeah,
a flash flood.
yeah,
Everybody go to this one room, lock the door, wait till, emergency services comes through, whatever the case may be, and that's that. You know what I mean? Like, um,
no, agree.
and a lot of
Keep it
times
simple.
with, yeah, you got to keep it simple. Got to keep it simple. With the safer guide, it's going to be the same thing with, your business associates, get on them because they got to do this stuff. They got to do a lot of this stuff that they've been ignoring for quite some time. So
And
it'll be
keep them
very, very
accountable.
necessary. Yes, you got to keep your vendors accountable just like if they're employees. And if you're not
Absolutely.
keeping anyone accountable, you've got high turnover because you're losing all your best employees and you're getting stuck with the crap. Because even if you have a good person there, they're going to get fed up with the lowest common denominator basically running the practice.
Right. Good point, Jose. Again, I appreciate everybody that participated in today's webinar. I hope you guys found some value in this, and we hope to keep and continue to provide these valuable webinars on a weekly basis. And if you guys have any questions, concerns, please feel free to reach out to Jose or myself. We'll be happy to assist you. And if you guys have any topics as well that you want us to speak on potentially, let us know. We're certainly open ears here. If maybe there's some sort of new legislation coming down the pipeline that perhaps we haven't heard of,
Yeah.
we're interested to hear it, and we could potentially talk on it as well. But I want to open up just for a quick Q&A. If you guys have any questions, just feel free to put it in chat and we'll be able to answer.
Well, people are typing or not typing, whatever they're doing. What's on deck for next week?
Yeah, good question. So obviously shifting away from the safer guides, but sort of in a way same perspective. We're going to be talking about the official topic title is enhancing healthcare efficiency, structured EHR documentation. So that session will sort of explore the benefits, strategies of implementing structured EHR documentation, ultimately to help streamline healthcare workflows, improve data accuracy, enhance patient care delivery. So
Cool.
just kind of goes hand in hand with the safer stuff in a sense, but
Yeah,
that's what we got lined up for next week's topic. So I hope to see you guys on that. There will be a registration link that will go out this afternoon. So for those of you that joined today, look forward to seeing you then. And like I said, it's going to be a good topic, good subject.
sounds good. Sounds good.
So I don't see any questions coming through. That's okay. Again, appreciate everybody's participation today. Jose, always a pleasure.
Always a pleasure.
And
Always a pleasure.
we'll see
Don't
everybody
forget
on.
to like and subscribe to the YouTube channel
Yes, don't forget to like
that
and
edit
subscribe to our
compliance.
YouTube channel. We are going to be doing better at advertising that some more. Actually, I have it in the slide here. How about that? Boom. So please feel free to give us a follow, a like. Again, we got a Facebook, Instagram, LinkedIn, and we will be posting the recordings of these webinars on our YouTube channel as well. So if you know somebody that you think may have benefited from this presentation that wasn't on the webinar, please feel free to share. Jose, appreciate you once again, and we'll see everybody
Always
on next week's topic. You guys
stay
take
out of
care.
trouble, guys.